It's fine. So which
Sorry,
topic you want to talk? Which topic of
nephrotic syndrome.
nephrotic syndrome? So
Hmm.
history taking, right?
Yeah, history taking. So, uh, is it visible? Nephrotic syndrome. Yes, scenario. Here is a one scenario.
Yeah. Let me see. Yeah.
Okay. So, okay. So 3 minute time. I start 3 minute time. Time will start. Okay. So time is finished. Okay, good evening.
Hi, good evening.
Yeah, my name is Dr. Rahman, one of the register in this pediatric nephrology outdoor. So, how are you? And how can I
Well,
address you? How can I address?
yeah, yeah, I'm Maria. I'm James' mom's.
Okay, so thank you, Miss Maria, uh, and thank you, James. So how are you, James?
Well, I'm a bit worried about James. Actually, have you might notice that James is having puffiness of the face,
Yeah.
and I'm a bit worried about his pee is also reduced.
Okay. Thank you, Mrs. Maria, for your information. Can you please tell me more about your puffy face? From how many days uh, he has suffering from this puffiness
Yeah,
duration?
I've noticed this yesterday. So he woke up yesterday, noticed a bit of swollen eyelid. So I was thinking that maybe it was because he has been waking up. But this today I've noticed that his whole face has been puffy.
Okay, so it is a whole face. Any other side swelling like a leg edema or ankle that is wrist edema, hand edema? Have any?
No, I don't notice any other swelling apart from the this facial swelling.
Uh, well, Mrs. Maria, uh, you said that James has a little scanty pee. Yeah, it is for how long?
I've noticed this since yesterday. So he hasn't go to the toilet. I told James that why not you go to toilet the whole day? He said that I don't want to pee. I've noticed he only pee one times yesterday, but today I don't find any pee. He doesn't pee at all.
Oh, yeah, sorry. It's a really bad thing there, single time pee. So, Mrs. Maria, can you please tell me what is the color was uh, pee color was? It is
It was a bit dark because of this less amount, but I've noticed a bit of frothiness.
okay. So, did you check his protein creatinine ratio, that is the urine depistic test? As I can see that James having 5 times relapse past. So, I think you know about depistic test. So, did you uh, test
I
the?
don't know about this test, doctor.
Okay, so from urine, that is deep stick to see the protein urea. Okay, so well, it is not a big issue. Uh, uh, any issue about abdominal pain or other symptoms?
No, I don't notice any of tummy pain.
Okay, so any fever,
No,
any weakness, any side weakness of the any side of the body, or headache or visual problem, or
no,
joint pain, rash.
no.
Okay, so can you please tell me the recent any recent exposure to a measles or chickenpox patient?
No.
Okay, thank you, Mrs. Maria. Uh, can you please tell me his past history from when James was first diagnosed with nephrotic syndrome?
Oh, yeah. So Jane has a nephrotic syndromes when he was about 2 years ago. It's been quite, off and ons, and James need admissions for quite a lot of time, like 4 or 5 times, because of this relapse.
Okay, so that means 2 years, and several times he was admitted in the hospital for this. Okay, any allergy history, any drugs or any food?
No, no allergies.
Okay, so uh, then uh, can you please tell me about birth history? Is it was uneventful or any issue during birth?
Well, no issue. He was born by normal birth, full term, no problem afterwards.
What's about immunization of Mr.
Oh,
Of
well, up
James
to date.
up to
And
date?
we give extra vaccines because one of his GP doctor recommend extra vaccines, so we have given all those vaccines.
Okay, thank you for giving extra vaccine. And what about his nutrition? That means what is about his appetite and his growth? Is there any issue about his growth related to his growth chart?
I've noticed he is a bit stunted in terms of the growth. He is smaller than his other peers of his age. So I discussed with the GP, and GP told me that it's quite normal because he has been on the steroid. Yeah, that's the only worry I also have.
Okay, thank you, Mrs. Maria. Can you please tell me about his developmental history? Is he going through as a normal, like he's walking, he's speaking, and his that is cognition? Is it all right?
No, it's fine. He's fine.
Okay, so uh, can you please tell me what drugs currently he is taking for nephrotic syndrome or other uh, causes, other illness?
He was on the steroid for long durations, and then it has been stopped about 2 weeks ago. Um, but the problem is that whenever we stop the steroid, his
Mhm.
symptoms of this puffiness and this faulty urine has been started again, which is quite worrying because one of the doctor told that if that's so, they might need further investigations like biopsy, and which I feel very worried because he's quite young. I don't want that kind of invasive test.
Okay, thank you, well, Mrs. Maria. So, does James have any any that is skin change or weight gain or any abnormal behavior like high temper, that means irritability, any signs of steroid toxicity like these symptoms?
Apart from this short stature, I don't notice any of those things that you have asked me. You've asked me, yeah.
What about James schooling?
Everything's fine. The problem is that he has quite a lot of missed
Not
school
okay.
because of this admission, frequent admission, and not control with the medications.
Uh, okay. So another thing, does your income meet all the requirement? That means your
What do you mean? No, it's like cost of living is always high, and I'm the single moms working and taking care of two child, so it's a bit tough for me.
okay. Okay. Thank you, Mrs. Maria. I appreciate your uh, giving information. So yeah, right now I have only 2 minutes, so I have to just give a summary to my examiner. So then
All
just
right.
now I am summarized.
Okay.
Okay. Uh, my patient, James, a 7 years old boy who has been suffering from uh, puffy face and scanty urine for last 1 day, and he is a known case of nephrotic syndrome for last 2 years. Last 2 years, at that mean for last 2 years, he was admitted several times in the hospital with similar attack, and it was 5 times last 2 year, and he was treated with oral prednisolone for a long time, and when he stopped this relapse, that is symptoms again reappear, and he has no history of abdominal pain, any high temperature, any altered behavior, any rash or joint pain, or any history of contact with measles or chickenpox patient. And he regarding his anthropometry, he is oh sorry, I should ask about weight. Okay, he is stunted. He has stunted, but I forgot. But weight is missing. Okay, and urine depistic urine test uh, was not done. So, okay, it's finished, but okay, please criticize. It is my first presentation, so that's why I am also puzzled.
Mhm. No, I think you did very well. You asked a lot of questions. That's nice. And yeah, presentation it could be smoother once you do the practice a lot. Not an
Mhm.
issue. So in the history, you're good that you asked me about when you just dive deeply into the present illness, like I told the child's having puffiness of face. You go on the onset, character, duration. Did you ask about any aggravating factors, relieving
Uh,
factors, or is
no,
it like
no, yeah,
intermittent or
no,
continuous
no, no.
slowly?
Yeah, I missed this aggravating
Yeah,
relieving factor. Mm.
yeah. So even though nephrotic child can have an anaphylactic, so the puffiness could be relapse of nephrosis, or it could be
Allergy.
anaphylactic. So
Mm-hmm.
if you ask about anything that triggered this puffiness, or is this happen out of no reason, anything that relieve the swelling, it would be nice. And also you asked me about the urinary symptoms. That is great. Amount of the urines, color of the urines, frothiness. It would be better if you can also ask about urinary tract infection features like
Mm-hmm. Yeah,
dysuria,
yeah,
frequency.
dysuria. Yeah, yeah, absolutely
It would
right.
be nice. That's great. And you also go further about complication of nephrotic syndromes like any abdominal pain and reduce urine output, shock, abdominal pain. That is good. Sometimes nephrotic children are susceptible to infections. So you also ask about any fever, recent infection features like measles, chickenpox. That's also nice. And you also ask about steroid side effect. That is good. But one thing is that do not ask all the symptoms altogether. For example, you
Mm-hmm.
ask me that does the child has any side effect of steroid like standard growth, tummy distension? You ask me a lot of symptom at one time, which is
Mm-hmm.
quite confusing for the parents, and
Yeah.
examiner do not like this kind of thing. So just go one by one.
One by one, yeah,
Um,
you're
yeah.
right.
And use a lot of the jargons like urine dipstick. And so do not use the jargon whenever possible because in
Mm-hmm.
UK center, I have heard that some of the candidate they give only 0 or 1 marks. Mention that this candidate use a lot of jargons. So yeah, they are very sensitive to using the jargons. Do not use that. That is the one thing. But I think that did you forgot to ask about the jaundice because
Mm-hmm. No.
sometimes liver failure
Mm-hmm.
can also cause the swelling. So yeah, so the differential diagnosis could be nephritic, nephrotic, allergy, liver
Mm-hmm.
disease, congestive cardiac failure. So you could also ask about whenever you see the child with edema, it's also good whether it's a renal cause, liver cause, or cardiac cause. So better ask in a systemic review about cardiac symptoms, shortness of breath, chest pain, arrhythmia,
Mm-hmm.
palpitations, leg
Yeah.
swelling, and
Yes.
also chronic cough, any tummy distension, any yellow coloration of eye and skin. That's great. Another thing is that you need to ask about past medical history. But you asked me the nephrotic syndrome past medical history, but you also have to ask about any history of recurrent sore throat, skin infection, because sometimes there is a nephrotic syndrome.
So,
So we also need to consider that as well. And also in if you confirm that this is a case of nephrotic case, then you have to differentiate whether it is a relapse or steroid resistant or steroid dependent by asking
mm,
more about the drug history in detail. How many tablets,
how
is it
many?
steroid only, or how long durations, and those kind of, but you ask those kind of things, so it's not an issue.
Yeah,
What
it
else?
should be elaborated.
But you did ask, you asked me about other history like growth, allergy history, perinatal vaccination, development, family history,
Mm-hmm.
social history. So, in terms generally, you did not miss any single things for the uh, so highlighting, like you didn't miss anything, just only a few little thing in between, which you could add. It would be better, but it is nice. Yeah. So in the presentation, you can say that this is a 7 years old child presented with puffiness of the eye for 2 days duration, along with reduced and frothy urines. once one he pee one time about in 24 hours. The
Hmm.
child does not have any current history of the fever infection, so any history of the complication related to nephrotic syndrome. There isn't any other other features suggestions of the differential diagnosis of like nephrotic syndrome. No feature suggestions of cardiac failures and liver failures. The child has been diagnosed with nephrotic syndrome 2 years ago, has been on steroid, but whenever he stopped the steroid within 2 weeks, his symptom has been relapse. So yeah.
Yeah. And finally, my provisional diagnosis is frequent relapse nephrotic syndrome.
That's right. Because in the definition, it mentioned if it is two
Hmm.
or more relapse within 6 months of diagnosis or four or more per years.
Yeah.
So, yeah.
Okay, thank you. Yeah, so
Yeah.
can you do as a examinee? Can you practice?
Yeah, I want to practice if
Okay.
possible. This case.
Okay, just okay. Just this session will finish and join again same link because it is only
Okay.
3 minutes left. So here is another two person here, or another one person. This is Ramisa. Ramisa, please introduce yourself.
Hi, Assalamu alaikum. I am Dr. Ramsha and
Hello. Welcome.
Uh,
also
uh,
preparing for
yeah. So
MRCPCH clinic. Okay.
we all are here, our AKP partner. So our
Yes.
we
Yes.
study together. These five people we study AKP. She is gone,
Yes.
and we pass together. Okay. So please join again with this link.
Okay. Okay. Okay.